My name's Eric. I go to SCF for my BSN. This is Estrella. She's agreed to do an interview, and I'm doing my cardiac, respiratory, and vascular assessment. I would walk in, wash my hands, identify my patient, two identifiers on her bracelet, name and date of birth. So then I'll explain what's going on. I'm going to be looking at her chest, make sure there's symmetrical expansion. I'm also going to palpate any nodules or crepitus. At the same time, I'm going to also be looking at her skin, make sure that feel it, if it's warm, pink, within normal limits for her skin tone. Check to see if there's any scarring, tears, bruising. I would look under the gown. In the hospital, we'd have a gown on. So then I'm also going to be looking at her respiratory rate, rhythm, and effort. She has a mild effort. The rate, a good way to check is with your hand on the chest. Watch your hand rise. Do it for a minute. I would say just look in probably about 16 per minute, which is normal. So then I'm going to check for her trach just to make sure it's midline. And you're going to follow it down to the suprasternum. Then you have your sternum. You have your angle Louise. Then you have your costal angle. And then if you could, I'll have you stand up. And then turn so we can see right there's good. So now I'm going to check for C7 and T1. Okay. I'm going to check for thoracic expansion. So I'm going to go down to the 10th intercostal space. I'm going to have you take a deep breath in, out. Nice. It was equal rise, so that was normal. And then I'm going to actually have you say 99.
99.
And each time that you feel my hands touch you, okay?
Mm-hmm.
Go.
99. 99. 99. 99. 99.
Okay. And I felt 99 equally on both sides. It was symmetrical. Excuse me, my apologies. So there's no, it's negative for bronchophony. And then you can go ahead, you can sit down, please. So I'm going to take a look as well, make sure there's no jugular venous distension. I'm also going to listen to her lung sounds. So first I'll go bronchial, and then I'll do bronchial vesicular. So bronchial is going to be here, deep breath. Nice. And that's for bronchial. And then of course I would do this under the clothing. Go ahead. Nice. Again. That's bronchial vesicular. And then, excellent. So then you have your vesicular. I'm going to note if there's any wheezing, crackles. Her lung fields were all clear, so that's a normal finding. After that, I'm going to go ahead and take a listen to her heart sounds. I apologize. I'm going to go to the back. If you could just, you can stand up. And I'm listen to her lungs on the posterior side here. And I'm going to make sure that I'm not on the sternum. Nice. Deep breath. Excellent. Let it out. Excellent. Cross your arms, please. And then deep breath. And one more. Good. My apologies, I meant scapula. Sorry about that. You go ahead and sit down. So next I'm going to listen to her heart sounds, and I'm going to let you know which valve we're actually listening to. So starting at the 2nd intercostal space. Aortic. Pulmonic. Herb's point. Sorry. Tricuspid. Lift up just a little bit. There you go. mitral valve. And I'm noting that S1, S2 is present. If there's any murmurs, if I hear anything abnormal, skips. So, and then after that, I'm going to go ahead and I'm going to start checking out as far as the vasculature system. I'm going to make sure that I'm going to look at her arms, any pain or anything that you feel, any issues that you know of with your arteries, veins, anything like that. Okay. I'm going to go ahead and check cap refill. Looks good. Looks good. So I'm going to check, at the same time, I'm going to go ahead and check her pulses just to make that sure that they're both equal. We're checking for strength, +2 is normal. Rate 60 to 100. Hers are, that's good. I'm also going to go ahead what's called the Allen's test. So what you're going to do is you have your ulnar radial nerve, or artery, my apologies, and you're going to stop both with your fingers. You're going to press on them. You're going to note that the skin's still pink and full of blood. So then I'm going to have you make a fist, please. Let go. Excellent. So then you notice her hand's white. You're going to let go of the ulnar and it refills, so that's showing that it's enough for the vasculature just without the radial artery. Okay, so next I'm going to also feel for carotid, and you can also do the apical and carotid at the same time to make sure they're equal. Hers are. And then I'm going to look at her legs. I'm going to tell you where her, so you have your radial, we're going to do the brachial. Carotid, you would only do one at a time. Can you stand on the bed? I'm sorry. So then I would have to do the popliteal, which is behind the knee. And then on her foot, I'm going to do, I'm sorry, I'm going to bring this over. I don't know if they can you see that? So I'm going to do your dorsal, tibial, and then popliteal was medial behind the kneecap. Thank you. I'm also going to look for any edema, notate any edema in her, whether it's in her arms, her legs, her feet, any venous distension. And then I'm going to check for any clubbing, make sure there's no clubbing on her fingers. That shows good oxygenation. Also going to check earlier just to make sure any scoliosis of any kind. Spine looks good, looks straight. And then I'm going to check cap refills on her toes. And that would complete my assessment. Thank you.